Okay, let's unpack this. We are starting 2026 by diving straight into a key event that, while it seems small on the surface, it really says a lot about the financial stress that's just crushing the U.S. community pharmacy sector right now.
Exactly. I mean, the pressure has been building for years, driven by these major reimbursement conflicts. But now that stress is hitting the micro-regional, independent level.
Community staples.
Right. This isn't just about Walgreens or CVS consolidating anymore. This is different.
We are focusing on the Chapter 11 bankruptcy filing of Uptown Pharmacy of Kingman, Inc. This was a single-location operator in rural Arizona. It's not just a local story. It's a clear signal that investors really need to pay attention to because this is happening all over the country.
It is.
So what actually happened here? Tell us the specifics.
Okay, so Uptown Pharmacy, which serves people in the Kingman and Golden Valley areas of Arizona, filed for voluntary Chapter 11 protection. And they did it on December 31st, 2025.
Right, on New Year's Eve.
Yeah. And this was a deeply rooted local business. It was incorporated way back in 2003, and they were, frankly, vital for Mojave County's rural health infrastructure.
So they weren't just a drugstore?
No, not at all. They weren't just dispensing pills. They were providing basic healthcare access, immunizations, medical equipment, all in an area that, doesn't have a ton of other options.
And the immediate catalyst, the thing that finally pushed them over the edge, was mounting litigation pressure.
Right. It wasn't just a slow death by 1,000 cuts on their margins, although that was definitely the root cause. They were sued earlier in 2025.
By who?
By their main pharmaceutical wholesaler, a company called Health Source Distributors, LLC, over unpaid inventory costs.
So the supply chain broke down.
It shows that when the cash flow just vanishes, the first domino to fall is the supply chain. Uptown has stated its classic Chapter 11 intent, which is to restructure its debt or sell its assets, all while trying to keep the doors open for the community. They're clinging to that hope of reorganization.
The fact they chose Chapter 11, though, instead of a straight Chapter 7 liquidation, that tells us something, right?
It does.
They must believe there's still a viable business to salvage, even if the current debt load is just impossible.
That's the whole point of Chapter 11. It's reorganization. They get to operate as a debtor in possession, trying to negotiate a compromise with creditors to swap out that debt for more equity.
And they hope to confirm a plan that gets court approval.
Right. A plan that could potentially discharge some of their old obligations.
But if the financial metrics, which we're about to get into, are this bad across the entire sector, how much leverage does a small pharmacy like Uptown really have against its big creditors? I mean, don't they usually just want liquidation?
That is the critical question. Now, if creditors do push back, the court can still approve the plan through what's called a cram down, as long as it's fair and equitable. But the whole valuation process is just agonizingly subjective and really expensive.
It's not easy for a small business.
For a small pharmacy, navigating that successfully is a massive, massive undertaking. A lot of the time it's just delaying the inevitable, but it does buy them some time to find a buyer or maybe some new operational efficiency.
So let's connect Uptown's struggle to the bigger picture, the macro environment, which is just punishing right now. This is one data point in a really severe trend.
It's a huge trend. Nearly 7,000 pharmacy locations have closed nationwide since 2019. That's an unprecedented decline over the last decade.
And it's not just the little guys. The decline isn't sparing the giants. The major chains are consolidating their footprints aggressively because even their scale can't absorb this kind of financial pressure anymore.
We all saw it. Rite Aid completed its nationwide operational shutdown after filing Chapter 11 last year.
And their competitors are doing the same thing. Walgreens has plans to shut down, about 1,200 stores through 2027?
Roughly, yeah. And CVS is continuing its multi-year downsizing, closing about 270 stores just in 2025.
But here's the key vulnerability for investors to track. Independent pharmacies like Uptown are just so much more fragile.
Way more. They are more than twice as likely as the chains to close, often because they get shut out of the lucrative preferred pharmacy networks that are controlled by these powerful pharmacy benefit managers, or PBMs.
Okay, let's unpack the PBM pressure cooker, because this seems to be the real engine of destruction here. What exactly are these PBMs, and why are they the core reason we're seeing 7,000 closures?
So PBMs are essentially the middleman. They manage prescription drug benefits for health insurers, for big employers. They decide which drugs are covered, and this is the crucial part. They process the claims, and they set the reimbursement rates for the pharmacies that actually give you the medication.
And they've basically engineered the system to squeeze margins down to nothing.
Yeah.
Sometimes even forcing the pharmacy to sell a drug at a loss.
Precisely. They aggressively slash reimbursement rates, which is painful enough, but the most unpredictable and devastating tool they use is something called the DIR fee, direct and indirect remuneration fees.
That sounds incredibly bureaucratic, but you're saying they're like financial torpedoes.
Mhm.
Explain what a DIR fee is. How does it cripple cash flow?
A DIR fee is a retroactive post-sale price adjustment. So imagine you're a pharmacist. You sell a prescription for $100. Weeks, maybe even months later, the PBM comes back and says, actually, based on some performance metrics that we made up and assess on our own, we're clawing back $15.
After the fact.
Long after. The pharmacy already paid its wholesaler for the drug, and now its profit is just unpredictably wiped out after the transaction is totally complete, and the lack of transparency means a pharmacy can't even budget for it.
And the data on the financial health of the independent sector is just staggering. It proves this model is completely non-viable.
It is. A survey from early 2025 showed that 80.3% of independent pharmacists reported their financial health declined in 2024, and nearly half of them, 48.6%, said it declined significantly.
And they know who to blame.
Oh, the culprits are crystal clear to the industry. An overwhelming 96.5% of these pharmacists said that CAS-M and plan reimbursement for Medicare Part D threaten the viability of their entire business.
Wow.
And to put a finer point on the loss-making, 40.8% of independent pharmacists reported they were paid below the national average drug acquisition cost, that's NADAC, on over 40% of their Part D prescriptions.
Okay, stop there. That means nearly half the industry is actively taking a loss on almost half of its Medicare business.
That's how unsustainable it is.
That statistic is the single most critical investment nugget here. When a business is forced to run its core volume at a loss, it is fundamentally broken. Let's pivot now to the investor context and the outlook for 2026, because the bad news is not stopping.
Absolutely not. On top of the PBM squeeze, there's a massive new regulatory headwind, the Medicare Drug Price Negotiation Program. It just went into effect January 1st, 2026, and it's creating immense capital stress on top of everything else.
But wait, how does government drug negotiation specifically harm the independent pharmacy? Isn't that supposed to target the manufacturer?
It creates a new enormous cash flow float problem. Under the program, if a pharmacy stocks one of these negotiated drugs, they have to pay the higher wholesale price for it up front.
Okay.
Then they have to wait for the manufacturer to refund them the difference from the negotiation, which can take weeks or months. This means the average independent pharmacy will have to float over $27,000 every single month just to cover these delayed payments.
That is an insane requirement for a sector that's already drowning in debt and getting hit with clawbacks.
It's Orwellian.
They have to take on huge, unsecured short-term debt just to comply with a price control program that's supposed to help patients.
It's forcing impossible choices. This float requirement is so burdensome that back in 2025, a staggering 93.2% of independent pharmacists were considering or had already decided not to stock one or more of the first 10 negotiated drugs.
Which completely defeats the purpose and restricts patient access.
Severely. And it creates immediate regulatory friction.
So when you look at the whole picture, PBM pressure, wholesaler lawsuits, this new $27,000 monthly cash float, it's no surprise that a third of the sector, 30.3% of independents, was already considering just closing up shop last year.
And this forces a crucial evolutionary path for survival. The pharmacy has to adapt. It has to go from being a prescription dispenser to being a frontline healthcare provider.
So expanding clinical services.
Exactly. Vaccinations, test and treat protocols, chronic disease management. They have to find new revenue streams that the PBMs haven't figured out how to squeeze yet.
And the 2026 forecast shows that data-driven AI solutions are going to be critical to make this pivot happen.
Right. Not to replace the pharmacist, but to tackle all the grunt work.
Like what?
Automated documentation, predictive scheduling, basic analytics to identify patients who need an intervention. This is necessary because of the severe staff burnout and the looming labor shortage, which is driven by declining pharmacy school enrollment. The whole industry is searching for massive efficiency gains to survive this crunch.
Let's talk about the consequence of all these failures. From the major chains, right down to micro-regional players like Uptown Pharmacy. We are seeing a rapid acceleration of pharmacy deserts.
Yes, and this is the real social and economic cost. The local pharmacy has long been one of the most accessible healthcare locations in the country. I mean, 90% of Americans live within 5 miles of one.
That's an amazing statistic.
It is. And when these places close, particularly in rural communities like Mojave County where Uptown operated, it disproportionately harms marginalized and medically underserved populations. It just accelerates health disparities.
Okay, now for the segment where we put on our high-risk, high-reward hats and acknowledge the massive disruption happening in the retail and healthcare real estate space. This is the segment we call This Is Not Financial Advice.
And we are focused squarely on the commercial property implications of this widespread consolidation. The failure of Uptown is just one localized, reflection of a systemic vulnerability in regional real estate portfolios.
So the trade idea today is initiating a short position on specific commercial real estate assets, probably through specialized REITs or debt products that are focused on regional retail properties in secondary and tertiary markets.
And the rationale hinges on combining two big factors: the major national chain consolidation and the collapse of the independent sector.
Right. You've got Rite Aid completing its nationwide operational shutdown, which creates massive vacancies everywhere.
And at the same time, Walgreens is planning 1,200 store closures through 2027.
And then simultaneously, you have the independent pharmacies like Uptown, who often anchor smaller strip malls or community commercial centers, failing because of this PBM crisis and the new Medicare cash flow rules.
It's a cascading failure. We believe this confluence of events is going to lead to an accelerated vacancy rate and a sharp near-term repricing of commercial rents in these non-core markets. And these repricings will far outpace the conservative analyst forecasts that are just based on, general retail property averages.
Because losing a community anchor tenant, whether it's a big Rite Aid or a highly trafficked independent like Uptown, disproportionately guts the traffic and property values for all the adjacent stores.
Exactly. In a dense urban environment, a vacant space gets filled pretty quickly. In a tertiary market, losing that staple can sink the whole block.
So the market has priced in general retail headwinds.
Sure, but we think it has underestimated the compounding localized impact of the pharmacy sector's systemic crisis. If these vacancies all hit at the same time in Q2 and Q3 of 2026, the short position in specific regional retail real estate could generate significant alpha.
High risk, high leverage.
For sure. But the data on the sector's viability suggests a very rapid deterioration of tenancy is coming.
So to recap our deep dive, the Chapter 11 filing of Uptown Pharmacy is the latest clear evidence that PBM-driven financial stress and new regulatory cash flow burdens are hitting even the smallest, most essential healthcare providers.
And this pressure is forcing the sector to seek survival through clinical evolution and AI efficiency, which is fundamentally changing the patient experience. But it comes at a great cost to accessibility.
So what does this all mean for you?
Well, the inherent conflict is simple. As the pharmacy industry focuses inward on consolidation and efficiency just to financially survive, the accessibility that made it a crucial community cornerstone is rapidly eroding. The final thought we'll leave you with is this: how do health systems manage an aging chronic population when their most accessible frontline healthcare resource, the local pharmacy, is quickly disappearing? And what will that widening health disparity cost society and the economy down the line?
Thank you for joining us for this in-depth look at the state of retail pharmacy. We'll see you on the next deep dive.